North Shore Medical Center, and you are the newest naturopathic doctor. So, what does that mean when people hear that? Okay, Dr. Dale has a different name with regards to natural. Is it natural? Let me pronounce it right. Is it naturopath?
Yeah, we are called naturopathic doctors, or you can refer to me as a naturopath. Yeah, either of those are fine, or ND. Uh, N for naturopath and D for doctor. So yeah, my perspective is just, very similar to NMAC in that I'm concerned about getting at the root of the problem. We don't just try to Band-Aid things up. We really want to figure out what's going on and help our patients feel better. And I look at things also as if the body itself has an innate ability to heal. So I'm the guide. I redirect, and then I might find something else that's going on, and then we work even deeper. But I work with nutrition first, so we always are talking about what you're putting in, not only food, but, your mental outlook as well. And then we work with vitamins, and we have some amazing new treatments that we're doing here. I mean, I guess that's why I'm the new doctor. We've added in acupuncture and spinal manipulation that I've been doing. Actually, I have someone cooking right now with acupuncture in the other room. So that's been wonderful to add a couple of new treatments here as well.
Okay. So, Doc, now you have years of experience. Obviously, I'm sure that you have seen many patients over the years with different, concerns and or issues. So, some of the issues, well, we have so many issues in Bermuda, or individuals, from high blood pressure to diabetes. You have many women that they never realized they had issues with fibroids. So, where do we begin? Do we have to start from within, changing our eating habit, or getting to, like you said, getting to the root of the cause?
Yeah, well, you come on in and have a chat with us. We've got a facility here that, not only the naturopath, but also the medical doctors, rheumatologists with Dr. Gonzalez, and we have Dr. Cindy Morris here, of course, Dr. Brown. So all of us work in a team to find out, and Dr. Eswick, of course, as well, in trying to understand what is going on. So we work with, some internal, looking at blood work, but then I do a full intake, physical, and look at some things that, maybe there's something going on with your nails. Then that's going to indicate to me that there's some sort of a vitamin deficiency. So we look at vitamin deficiencies. We look at what's going on with your stool as well. That's a big one for naturopaths. And try to understand, are you clearing things out of your body? I know a lot of Bermudians are concerned about making sure their bodies are functioning well, doing like a cleanse, detox, and that kind of thing. And we're really concerned about that, or work on that as well, using food and using the colon hydrotherapy to help. If we find that there's vitamin deficiencies, then we'll, go ahead and schedule you for an intravenous infusion so that you can feel better quickly. And then we start to see, okay, well, why did that vitamin deficiency happen in the first place? What's going on? Is there something that's genetic, or is it just too much inflammation in the food that you eat? So really, it can be overwhelming as an individual, but that's my job, right? My role is to support you and to make it as easy as possible, and to make it fun too. We have a lot of laughter coming out of this room.
Oh, wonderful.
Yeah, so that's how we go about it. We really just try to make it as simple as possible for you and fun as possible as well.
Dr. Dale, for those that don't know, you are a board certified naturopath, a doctor providing natural and alternative primary health care for basically over 20 years. At what point did you decide to go this route versus maybe the normal route with regards to doctors?
Yeah, I never saw the normal as normal. I always saw this as the normal. My grandmother, Jessie, she was, a whole food foodie. She educated me about vitamin E and using rosehip and eating whole foods, avoiding sugar. And that was from a young age. I thought it was a bit odd at first, but then as I started my own journey, I started to try to understand what was going on in my body, other people were taking medication in order to moderate their menstrual cycle, where I was thinking, well, do I really need that? I mean, what is that all about? And I started to delve deeper, and I actually met a medical doctor who started to introduce me to the fact that, hey, there were other ways to understand what was going on in my body, to understand my ovulation, to understand what was happening, what was changing. So I would say that at a young age, very young, started to be educated about food, and then started to understand more about our hormones as I was in my teens and early 20s. And of course, having my own children inspired me as well to understand more. And then starting to treat patients, worked a lot with infertility, and that inspiration was, probably around the age of 17 that I really started to understand about herbs and acupuncture and how what we're eating can really make a huge impact on how we're feeling.
Wow.
So a young age, yeah. And I thought one of my fortes has always been listening. So I did consider doing like an art therapy or something like that, but I wanted it to be more primary care. I really wanted to be able to support people from the basics. And this medicine came up as I, was introduced actually from a friend of mine, was studying naturopathic medicine, and that was in my first year of university. And then I just remembered that and how interesting it was, and how he told me, we look for the cause. We don't just treat the symptoms. We really do look to try and figure out what's going on a deeper level.
Okay, now Dr. Dale, you know that obviously I have many individuals that listen to my show from young to seasoned. So we have young women that have questions about their body with regards to fertility, and they would like to get pregnant. Then we have probably some middle-aged people that are experiencing some issues that they never experienced before. And then we have men that are listening that don't really go to the doctor for whatever reason, and some women, and they're like, okay, Miss Thang, I'm listening to you and Dr. Dale. What do I do next? Do I just call North Shore Medical Center and book an appointment or consultation with Dr. Dale to sort me out?
Of course, that's what you do. Easy peasy. Give us a ring. You can call us on 293-5476, and one of our wonderful receptionists will book you in with me. You can also email me at kdale@nmac.bm. And I do answer my emails as well. And it's a lot of fun. It's very painless, and we treat you very well here. It's a lovely space that we're in. We're right on the water. A lot of my treatments, actually, people can just gaze out on the ocean as they're being treated. So it's a place to take care of yourself, and I do have many male patients, which is wonderful. It's totally cool. It's different than other places that I've lived. I have all ages from 18 years old up to in their 80s, dancing out of here after we've done the treatment, loving the acupuncture and loving the treatments that we're doing here. So everyone is welcome. For sure, and that's a big part of what I do, is allow people to be who they are in the room, and really encourage them to keep taking care of themselves. So important, as mothers and caregivers and fathers, that we remember to take care of ourselves. Self-love and self-care are so important. And as we grow older, our responsibility to the young people is even more so important, and also for us as younger generation to respect our elders as well, and to listen to one another. So I welcome all ages for sure. Thank you.
All right. Now, for those of you that have just tuned in, I'm talking with Dr. Katherine Dale. She is Bermuda's newest naturopath doctor. She has joined the North Shore Medical Center. Now, Doc, I'm looking at your bio, and I just got excited because I am a fan of Hong Kong and Thailand. And I see that after graduation, you moved to Hong Kong for 10 years. And while immersed in the culture of China, Thailand, and Malaysia and Indonesia, you gain knowledge of Eastern medicine and traditions. Now, you have just piqued my interest just a little bit more because I guess the individuals over in the Asian side of the world, they do things a little bit differently, or they live a little bit differently than us in the Western society.
Yeah, it's incredible. I studied some feng shui as well as to help support my patients in their homes and in their office space, and to support them from a physical environment. And in Hong Kong, it's just integral. The way that your building is laid out, the number of your buildings. Every young person has a consultant come into their space and advise them, and they don't even really consider who it was or how it happened. And the way that people eat their food, and how granny or, grandpa or mom, how they're preparing the food, they don't even realize. There are wolfberries in their food or ginkgo seeds, and they have no idea of what all of these nutrients that are just a part of, everyday life. I would say Bermuda has some of that too. I hear about people, picking food from their gardens and grandma recommending this and that in order to benefit. Recently, I got a burn, and I was saying, where can I buy my aloe? And someone said, oh no, just go down to the corner. And they told me where to buy things, off of, or where to get my own aloe off of the street. And that's the way that Asians work. The way that they interact with their families is really being a part of a community. The way that they eat in a circle. Coming back to America has still been kind of funny because we eat in Asia all of our food together. Even if you're having tacos, you put those tacos in the center of the table and people share.
Okay.
And that is just like in and of itself representative of how the community intends to function, right? Where everyone shares. And it was wonderful to learn and just to kind of submerge myself in it, which I'm doing here too in Bermuda, submerging myself, being surrounded by wonderful Bermudians, being able to jump in the water here almost every day, soaking up that healthy sun and salt water as well. So I'm excited about what I've already learned and still have to learn from this place.
Okay, now I'm going to go down, list some of the main areas of practice for my listening audience that are interested in making their appointment with you. Anti-aging, acupuncture, annual physical exams, natural medicines, vitamins, herbs, and homeopathy, finding the root cause of illness, medical testing, thyroid health, digestive complaints, hair and stool analysis, sleep deficiencies, mental well-being, pain reduction, meditation and stress management, detoxification, nutritional support, women's health, IV nutrient therapy, naturopath, weight loss, and corporate wellness services. So it looks like, Dr. Dale, I'm looking at all of this. You have, I guess, covered or cornered the entire market with regards to pinpointing every area that needs addressing, from anti-aging to women's health, acupuncture, one of my favorites. So it looks like our listening audience are going to have a fun time with you, especially for those that probably haven't been to the doctor for a while with COVID. Wherever we are right now with COVID, stress has become an everyday ordeal for many people. A lot of people didn't realize that they suffer from anxiety or stress, and that has now taken part in their lifestyle as well.
Yeah, we see that. I see that particularly too, in certain communities, the elderly community as well. I observed how hard it was to be isolated with COVID, and how that really had an impact on levels of anxiety. So we take a look and see whether there is something physiological, like is your cortisol level high, and we can check that here. And then I of course have a conversation and encourage people to share what's concerning them. When we share in community, when we express our concerns, it's not a sign of weakness. It's a real strength to be able to admit that you have emotions that are difficult to deal with. So being able to support people physiologically and emotionally, and then to use, like you mentioned, some of the treatments here. Some of the points that I was just working with this morning with a patient are really about calming the energy, calming the body and reconnecting. So we can also use supplements to support people as well, and really just encouraging people to share about what they're experiencing and not to feel that there's any issue around it, that there's any shame or anything like that. It's a physiological issue, it's an emotional issue, and it's a community issue. We really need to collectively approach these concerns that we're having and not to isolate anyone.
Absolutely. Now, Dr. Dale, I just received an email from one of my listeners. Let me give you the short version. Ms. Thang, I am loving this interview with Dr. Dale. You have never had a female doctor on like this, so you need to have Dr. Dale on more often. I have a question, she says. She says she's 32 years old and she has issues. She's had issues for the last 5 years with her menstrual cycle, and now she believes that she's anemic. Every day is different. Her emotions are all over the place. Dr. Dale, what does she do? She's calling to book an appointment with you.
Yes, please come and visit me. And of course, we're going to start with looking at your sleep, what you've been eating, what your digestion is like, and then we, ask for support from our tech team here. We have our own lab here that we can do lab work with, and we send some things overseas as well to see what's going on. And then our lovely lab here, we're able to formulate hormones as well, bioidentical hormones if that's what's needed, and also use herbal support. So all sorts of things that we can help you with, as well as teaching you about some meditation techniques and yoga moves that are really supportive as well and release the tension in our bodies. Acupuncture as well is fantastic for any issues with our reproductive systems, both male and female. I've had some men coming in as well that, they want their tiger back, and so we definitely are working with that, making sure that they're feeling virile and excited about life generally, and also about their situation with their partners. So, don't suffer alone. Come on in and let's figure it out for you. And thanks for listening.
Thank you so much, Dr. Katherine Dale. For those of you that are tuned in, you can contact Dr. Dale at North Shore Medical Center. You can give them a call. You can book an appointment with Dr. Dale, and she will be excited to see you, consult with you, and get you on the right path. Young and seasoned, male, female. If you haven't been to the doctor for a while, if you would like a second opinion, if you have to lose weight, you're probably stressed out, or you don't know what's going on, definitely give Dr. Katherine Dale a call, and she is Bermuda's newest naturopath doctor. So congratulations, Dr. Dale. I'm reading your bio, and I'm like, wow.
I'm so excited to be here. Maybe you'll see you in the clinic.
You know what, Dr. Dale? After listening to you, I think I need to make a telephone call today.
My pleasure. Thank you.
So when our listening audience and anyone is calling, when they speak to the receptionist, they will just say they are booking an appointment with yourself.
Yeah, with Dr. Dale. Yeah, a naturopathic consult, and they'll book you in. And our first visit is usually about an hour, and then follow-ups, depending on what you're up to, can be half hour or 15 minutes if they're a shorter treatment. Our intravenous vitamin treatment can be a bit longer, can be up to 40 minutes. But yeah, they know what to do, and the first visit is a standard length of time, and we'll get you sorted from there. We guide you through everything. I've heard feedback from other patients that they really felt supported as we took them down to the lab and explained different things to them. And if needed, I always refer to, of course, they also do need to have their medical physical as well. So if that's a concern or something they're interested in too, we can set them up with some of the other doctors in the clinic if that's necessary. Yeah.
All right. Perfect. Well, Dr. Dale, we are excited that you are here. you are giving Bermudians, a different outlook on with regards to medicine and an opportunity to come in and talk with you the natural way. So get excited, Dr. Dale, because I have a very large following, and now they've heard, they're like, okay, I haven't been to the doctor. I have some issues going on. I need a second opinion. So they can call North Shore Medical Center at 293-5476 and book a consult with yourself. And all North Shore Medical accepts obviously all insurance, Colonial, CG Insurance, Argus, BFNM, etc.
Yeah, and remember that those signs, those little things, those niggling things that are going on in your body, those are actually messages. We talk about mind-body medicine, and your body is telling you that it has a concern whenever there's a symptom coming up. And the longer we ignore them, the more serious they become. So, yeah, don't be afraid of coming in for just something small, so that we can really work with preventative medicine, which is what naturopaths are about.
Absolutely.
We'd rather see you before the problem, so that we can help you and an easier way and get you on the right path with your diet and your lifestyle and different choices you're making.
Absolutely. Dr. Dale, very quickly, when you said something that made me want to ask this question. Is pain normal? When it comes to pain, some people think that pain is normal, but doesn't it mean that if you're having pain, your body is trying to get your attention?
I would say yes, that it is trying to get your attention. There are people who are, constantly in pain, and there are, different things like chronic fatigue or fibromyalgia, issues that we can, even in those situations where the whole illness is related to just being in pain, there are ways to support you. There are options for people to reduce that pain, perhaps even, get rid of the pain. But yeah, any kind of symptom that you're having that is new, something that's unusual to you that you haven't experienced before, whether it's a change in your digestion, whether it's, some itchy skin condition, or whether it's something more serious like headaches or a real serious pain in your back, we can really help you in those situations. So yeah, pain is a sign that you need to pay attention to and ask your doctor about, and get further treatment there.
All right, perfect. Well, Dr. Dale, I have enjoyed our conversation this morning. I will be encouraging and reminding everyone to take a look at your information. They already enjoyed the interview. They can give you a call. Actually, they can book a consultation with you at North Shore Medical just by calling 293-5476.
That would be great.
All right.
I look forward to hearing from everyone.
Thank you so much, Dr. Dale. Have an enjoyable day.
Thank you, Miss Thang. Have a good
great
day.
one. You too.
Bye-bye.
Bye-bye. Inside the 9 o'clock.